Hi, I'm Datuk Dr. Prethima Micheal and welcome to my first Facebook Live series. I'm going to dedicate about an hour of my time to answer any question that you may have for your beauty needs or for your general health as well, and especially on female health. Feel free to ask me. If you have questions during this session, if it's early on, I'll answer it today. If it is a lot later, then I'll answer it in the next week's session. Okay, so let's answer the first question that has come in. Can a pregnant woman carry out pigmentation laser treatment? It's a complex question. Going by the scientific reasons, yes, a pregnant woman can carry out pigmentation laser because lasers are very pointed, monochromatic. That means they only go to one part of the skin even, and they don't have the tendency to travel from one side to the other unless it's of a cutting type in very high energy setting. So it's rather safe, but however, this is where I feel I need to be like a psychologist sometimes. Sometimes if you see somebody who's extremely worried about their pregnancy or they have a lot of doubts despite the scientific truths and facts that I've told them, then it may not be a good thing to do the laser treatment for them, because just the anxiety I don't think will be good for their pregnancy, so I will refrain. But if it is a person who is very used to it and has got good trust and able to understand what I'm saying, then of course there is no contraindication to doing laser in pregnancy. Okay, there's one more question. If I just gave birth and I'm currently breastfeeding, how soon can a lactating woman start a fat loss, weight loss treatment at my ageless Medispa? That is the question. Well, of course, most women who want to go back to work or go back to social settings after giving birth to child, when their figure has changed, of course, they are very anxious to want to lose their additional weight or water retention that they put on. I would encourage women like this to come into the center so that we basically look at their hormonal issues, because the hormones do change after any pregnancy, and especially if it's a strenuous, stressful pregnancy. And also I would like to look at whether it's dietary issues or lack of activity because their time is too taken up with a child. If that is what is causing to additional weight gain other than what came on during the pregnancy, then maybe that's one of the first things I would like to correct. I would want to make sure the woman has some time for herself to be active. Also planning helpful meals is important. But I think this during confinement is not the best time to undertake a slimming program. If it is something to repair back your skin or something to reduce some stubborn fat, then that is fine. But if you have become grossly overweight after pregnancy and childbirth, this is not the correct time to be doing it. You at least ought to wait about 2 months before we go in for any actual weight loss programs. The reason being, the hormones are so in a different situation, and especially for breastfeeding a child, biology has made it such that the woman will conserve fat whatever she may do, whether she eats, she doesn't eat, or whether she breastfeeds or doesn't breastfeed, she will definitely conserve some fats. So if she starts something like this, other than healthy diets and activity program, looking after your nutritional side, correcting your hormonal issues, all of this will have a positive view, but it will not be the best time to undertake, I want to lose 20 kg in 2 months kind of programs at this moment. Okay, this is a very interesting question. Why does a Brazilian butt lift procedure have some risk factors and causes death if the procedure is not done correctly? I mean, butt lifts are getting more and more exciting, and something a lot of even younger ladies want it. But I think if you are doing something to augment it, like we do some fat transfers or we do safe fillers into these areas, that does not have the kind of risk as in deaths or severe complications. But when we are doing a full implant, as in a breast implant, there is buttock implants. Of course, if you are going to go deeper under the muscle, there are very important nerves and blood vessels, and if they are accidentally injured or cut, that is what causes the dangerous sequel that happens after the Brazilian butt lifts. Okay, got another question here. If there are some injuries on my face, can I carry out any laser treatments on my face? But I would like to know how long ago was the injury. Because if the injury is very, very recent, I would refrain from doing a laser, or you can always get the doctor or the health professional to cover up the scar areas, and then the rest of the areas can be treated by laser. But for any scar production, there is different stages. Okay, there's a stage of acute inflammation, then there is a stage of proliferation which goes on up to 6 months, where the scar may get thicker and may be looking, and then after 6 months there's a resolution phase where the scar tends to even out and look as much as it can under the circumstances in the surrounding area. So we have to point out, of course, if it is more than 6 months, then definitely a scar that's still there may need some treatment. So we can always do a general laser, and we can tackle these scars with our very specialized scar laser systems. Okay. If there is no other questions, this will be the last question, I think. When a person gets sunburn, is it recommended to get a laser treatment, and why? Again, this question has to be addressed in 2 ways. One is, if you are just sunburned, of course, that's not the best time to do the laser treatment. You need to give time for your skin to recover from the injuries from the sun's rays. Maybe there may be some peeling, there may be redness, inflammation, irritation, and if we add on a laser or a chemical peel at this time, it will cause more injury. So we are not going to do laser at this point of time, but we have other options as in skin healers and other vitamins that we can inject into, or even cytokines or stem cells which can be injected, so that the sunburn can be recovered without too much of problem. However, if it's already more than a month and then there's a lot of patchy pigmentation all over the face, there's more breakouts, there's irritation, then this is a time where we actually need to look at the skin and start to find the correct laser that will handle their skin. So if it's a lot of acne, then we're going to go for solar keratosis treatments using our favorite dual LOs. Of course, if there's a lot of hyperpigmentation or triggered melasmas, then we have to see which part of the skin this pigmentations lie in. Is it in the superficial part of the skin? Is it the superficial dermis, middle or deep dermis? So we need to identify, and according to that, use the best laser we can in these circumstances. But at an acute sunburn situation, it will be good to do treatments like oxygenation, but not laser. Okay, I think we have come to the end of the session. If there's any questions, anything at all, you can think of tips for your beauty, tips for your figure, tips about your children, or anything at all about medical side, please feel free to contact us, and I'll see you again next week, same time, same place. Bye-bye.